Okay, so it sounds like pain management is the primary concern for your knee surgery and managing your pain in the meantime. But we kind of talked about that a little bit, and you can always make a list if you have other ideas for how to manage your pain, or I'll do some research. You can do some research. We can talk about what we find next time, if that's okay, and then the mindfulness meditation in the next time, or in the meantime.
Yeah, that sounds good.
Okay, so outside of the pain management, do you have any other concerns for having this upcoming surgery, or any any other concerns in the meantime about having an upcoming surgery?
Um, I just hope everything goes good. I just have seem to have issues of when I get stuff done that things don't go the way that they're planned. The heart closure didn't go as planned. It went fine until I was ready to go home and one of the incisions busted in the where the artery was, and the artery when I stood up came open, and it was really a mess, and it was really bad.
That was with your heart surgery?
Yeah.
Wow.
So it wasn't supposed to happen. It usually doesn't happen. It just for some reason did, and it was just really gross and bad and disgusting. So hopefully that doesn't happen again. I mean, it was a pretty quick fix. I mean, it took they put a lot of pressure on it, got everything to stop bleeding and that, and then I had to lay flat for 12 hours, 12 long hours where I couldn't stand. So hopefully I'm just hoping everything goes as planned. So if the knee surgery goes smooth, I'd be happy. I don't want any more incidents. Which it's in the back of my mind because the other one was supposed to go smooth, and it's just something that makes me a little bit nervous, but hopefully not. But I don't really know. So.
So it's sort of out of your control. You're thinking like you can do everything. You can do everything and plan everything perfectly, but like you said, it might not go according to plan.
Just happens. Stuff happens, I guess. It's scary, but.
And is that does that bother you? Like, is that something that you think about now, or is it something you're not really thinking about because it's not for a few months?
I didn't really think about it too much because it was controlled within a good few minutes, and I was at the right place at the right. The hospital was, the nurses were there and stuff, and it was taken care of. It was just really gross and really nasty, but I think that hopefully it wouldn't have nothing like that happens again.
Yeah.
When I'm ready to get the knee surgery done, I'm sure a couple days before that I'm going to be a panic mess, like I was for the heart one.
Yeah.
But I ain't thinking about it too much now. But in a couple weeks, I'll probably be pretty freaked out about it, because then I'll be nervous.
Yeah. So freaked out, like when you say freaked out, do you mean like like typical surgery nerves? Like, are you like nervous and thinking about it a lot, or are you like not able to function? That sounds like a weird question, but you said freaked out, so.
Just typical surgery nerves and just nervous, like nothing like crazy, just nervous and typical nerves.
Yeah, which is to be expected if you're having surgery. It seems like I'm sure most people get nervous before surgery.
Yeah, nothing major.
So as far as in the meantime, is there anything that you have to do before the knee surgery? Like, are you sort of like you're gonna plan and do what you have to do? Is there anything else that concerns you? Like, do you have somebody to help you afterwards? Anything else that you feel like is sort of pressing about it?
Not sure about the aftercare yet. well, I have to stay on these blood thinners. That's my main thing for the heart, that I have to do that now. So I have to get that recovery done first. That's my main thing. Once that's all said and done, then we'll schedule the surgery probably after New Year or something like that. And then it'll be time to see who's gonna be able to be home to help, because I know it's a long recovery. It's not, something that is easy. We do have steps, and it's a long, a lot of up and down. I mean, even with the heart thing, I couldn't go up the steps for a week, because of what happened. So I have to, think about that kind of stuff. See who's gonna be able to be home, be with me to help, just to help out, and take care of the pets and stuff like that. So it's something I thought about, but it's not close yet, so I wasn't too worried. But it's gonna be a challenge.
So, yeah, I don't want to stress you out and make you plan it for it if it's not for a few months yet. But it sounds like you kind of know what to do. You're in a decent place until that surgery happens. So if you're okay now, I just take, say, 5 minutes to wrap up, and then potentially plan for next time, if that's okay with you.
Sure.
Okay. So I just want to ask for feedback first. How do you think this session went? Is there anything that you wish we would have talked about or did differently?
I think it went good. I will check out the help, for the pain to see how that goes. I'm interested to see what that would do for me for when I'm trying to sleep, because it's hard to sleep. It wakes me up. It lets me not go to sleep. So I'm interested to see what what that would do. I really would, because that might be something that would really help me. So I'd love to know what that is about.
And it is pretty cool. I can write some I'll find resources for next time too. But it's mindfulness meditation. It is really actually pretty helpful. So it's something worth looking into. It helps a lot of people.
Yeah.
So we said that brings us to the homework thing, assignment, whatever you want to call it. So for next time, just look up some resources, like choose 3, say I said 2 or 3, but whatever you can get done, whatever you have time for. I know you're very busy. Try them out. They're short. There's 5-minute ones, 10-minute. They don't have to be like 30-minute exercises or anything like that. You can do them while you're sleeping. And then maybe just remember some thoughts or write down some thoughts or feelings about it. If you liked it, if you didn't like it, why. If you feel like it's something you want to do in the long term. Because it is essentially something that you do over time. And it becomes helpful in the long run. And it builds up your tolerance in the long run. Not just doing it like once or twice. So potentially it could be something that you be interested in, but just do a little research. I'll bring in some resources next time. That sounds good.
Yep, that sounds good.
Okay. So let me see. We talked about homework. Talked about feedback. So in the meantime, I guess we'll end there. Again, I'm really happy you came back, and I'm happy your first surgery went well.
Yep,
Does that sound good?
Yep, sounds good.
Okay, thank you.
Yep, thank you.